I do see a lot of babies. People are like, well, what do babies need to be adjusted for? But I'm like, well, if you've ever been at a birth, you know that it's, even in the best of births, it can be strenuous for the baby. There's a statistic out there that over 80% of all babies born have some subluxation or misalignment in their spine. And so what I do, adjusting for babies is very different than adjusting an adult, mostly because they don't have years worth of stress and strain on their bodies. They don't have the musculature to kind of hold themselves tense or anything too. Often an adjustment for the baby will just include me feeling, or what we call palpating, up the spine. And if there is a misalignment, then I just hold the pressure, no more than pressure than I'd put on my own eyeball. With that, and then because there's not a lot of resistance, the babies will, and the bone goes back into place. A lot of babies will sleep through their adjustments. Some that start out fussy will fall asleep during their adjustments. And that's one of the things I often tell parents too. I said, when you bring your baby in, no matter what the age, babies and children, I said, if they sleep more than normal, that's very normal post-adjustment, because their body's been so tight and wound up that they're finally able to relax, and then they take a good long nap afterwards. Research has actually talked about this, that kids that are under regular chiropractic care are just healthier in general. Anything in life needs maintenance. I mean, people maintain their teeth. We take our kids to the dentist twice a year to just make sure their teeth are on track. Some people do well checks, and making sure their spine is in alignment is a good thing too. It allows them to live an optimal life with a little sickness. And a lot of the kids that I've been seeing for years, my own children, they rarely get sick because their body is working at its optimal level. I have 4 kids myself, and 3 of them are boys, and so I know what kids do on a daily basis, jumping off of things and just being children. And so I adjust my own children very regularly, minimally every other week. Like I said, because I see what they do. And then of course the stress and strains of being a student as they get older and they're sitting in the classroom, it's not an ideal ergonomic position for them. And then they've got the backpacks and things like that. So getting them adjusted through that allows their spine to develop normally, and then they don't grow up with the same problems that we struggle with on a day-to-day basis.